I'm so excited to have you. I think the stuff that you do really excites me, and I'm stoked to get into it because I know that we kind of discussed a little bit of like this quantum neurology and stuff like that you do. Sort of like, I'm going to call it sports medicine or movement. Okay. I don't know that I've got that fully right though. So you let me know, what is your specialty?
So everybody thinks of sports medicine a little bit differently. So I don't like to use the term sports medicine because, we don't like to use the term medicine. We're not MDs, we're not medical doctors. Quantum neurology really is a performance modality. It's a blend between functional neurology and sports performance, which I think is really cool because of my background kind of being from both. I've gone down the functional neurology route, but then I was a strength conditioning coach before. So I get to blend it a little bit, and I get to see it with everyday people and not just with the elite of the elite or, that high school athlete wanting to take it to the next round. So taking it with, some older patients or with just people who want to play pickleball has been fascinating.
Okay, so break down like the history of how you got into this specialty of chiropractic and where like you trained at and all that kind of stuff, just so we can get like the foundations.
Yeah, so this whole process started when I was in undergrad. So I was a strength conditioning intern at William Penn University. I had some fantastic mentors there, even from the head coach all the way down to the GAs were fantastic. As I was getting through that, one of the GAs introduced me to this technique called RPR, Reflexive Performance Reset. And it was a neurofascial technique. Everything was manual, where we would be able to stimulate the neurological system from trigger points, from neurofascial points, or neurolymphatic points in some cases. And we saw increased strength, increased reactivity. We had 40 times and pro agility times drop in a good way. And strength numbers increase. It was fantastic, and it took out compensation patterns, which was really, really important. So we started there. I decided I wanted to go into chiropractic because I was a collegiate athlete as well, and I needed help. So I went down chiropractic school, and then once we started getting into the science in chiropractic school, that's when the neurology started to happen. So that's when that science background started to kick in a little bit, not just the movement, muscle go up, muscle go down. So I started going through everything, and I was still doing it by hand. I got into the physics of fascia a little bit more, and I realized that fascia does a really great job of absorbing and scattering light. It was photosensitive, so to say. So instead of pushing in on people, I started experimenting with different light frequencies. Started with yellow. It took like 30, 60 seconds every spot, and that was just a waste of time for me because I could do it manually in about 10. So quantum neurology came up from one of my colleagues. He, kind of dabbled me into it, and they were using red and infrared light. Well, this red and infrared light that they were using, it didn't take 20 to 30 seconds. It didn't even take 10. You put it on that neuroreflexive point and boom, you get the results. So what we do is we test muscles, we test nerves specifically, just like any other doctor would. And then we put this red light on these reflex points. And then all of a sudden we test it again, and I could hang off their leg, or, they could lift me up and they'd have no weakness, but also they'd have no pain. And so that's the kicker. So when we can increase the mechanoreception, the movement part of the nervous system, we take away the nociception, which is the pain part. And that's where a lot of that impact is. And that's why people are like, oh my gosh, it's voodoo. But it's science, it's neurology.
Okay, so who is like your perfect patient that comes into your office and you're like, oh, I can help this person so much? What do they look like?
It's pretty easy for me to acknowledge someone who I'm excited about, which it helps if I'm excited about their health. It's the person who's excited about their own health. So most people who go into chiropractors, they're like, I didn't really want to come, but I want to be out of pain. And that's like, okay, I'll help you, but that's kind of it. But I have those people who come in, they're like, I'm so excited, I want to get out of pain, I want to extend my health span, I want to get better on these ways. And I'm like, yes, you're my person. Like, let's do whatever we can to help you, and then let's branch off as in many different ways as we can. So that's what I get excited about, people who are excited for themselves.
Yeah. So someone that is looking to optimize their health and optimize their life, and maybe they've got a couple of the foundations in. What would you say, like, foundationally people need to have ideally before they start working with you?
It doesn't have to be anything crazy. I just want either that they're already active and they want to remain active, or they want to become active. So I think movement and activity, and whether that's just walking and biking, or if it's playing pickleball, or I have some really older people who are playing, very competitive tennis as well, and some extreme sports. It can go all the way from, just somebody who wants to get moving, who maybe needs to lose a little bit of weight, who wants to start that path, to even somebody who's on the extreme end and who needs to maybe fine tune it, because there's a lot of information out there about wellness, and we need to crunch it down a little bit and make it pretty streamlined.
Yeah. So let's talk about pickleball. It's super, super popular right now. All the old people are playing it, but like people that are younger are playing it too. And it's like this whole social sport. What kind of like injuries and issues are you seeing people come in with?
Major injuries when it comes to pickleball. One is the knees, right? Because they're doing a lot of side to side movement, a lot of quick and jerky movement. And they haven't been doing that for how many decades for the most part. And then also tennis elbow. So, flicking of the wrist, flicking of the forearm muscles all the time. Those elbows can get pretty tender and very sensitive. Both of those are pretty easy to take care of, but it happens so often that it does limit how much people can play.
Okay. So when someone comes into you with, say, tennis elbow or the knee issues, where do you start? Like, is it comprehensive, or is it with just the light, like, and adjustments? How does it?
So everything's pretty comprehensive. So I don't limit it to, let's say they come in with an elbow issue. I don't limit it to just the elbow. We test the neurology of the upper spine. We also test it in the lower half as well. So we do a full body approach when it comes to neurology. But then we'll focus on the elbow after that. We'll do some manual muscle work. We'll do some specific neurology that goes outside of the quantum neurology realm, which I can thank to my strength conditioning days. And then we'll throw in a couple exercises as well. So I do dabble into the PT to the rehab side also if needed. But we'll throw a ton of different techniques at a certain problem. And then after that, if we still need to, depending on the problem, whether it's a tendon or a muscle issue or just a neurological issue, then we can throw in some shockwave therapy, and that cleans it up most of the time too.
When someone comes in with these kinds of issues, I know that applied kinesiology is something that you're using to sort of test the muscles and do that kind of stuff. What does like a protocol look like for them, as far as like beyond coming in to see you and get individual treatments, like in their lifestyle?
Okay, so you're saying, what do they do outside of the clinic? Is that what you're asking? Okay, so when it comes to outside of the clinic, I am a huge believer, and I talk about this all the time in-house, about circadian biology. Circadian biology is my jam. So some really, really easy things that everybody can do and everybody needs to do is be outside for the sunrise, or at least within the first hour of the sunrise. They need to be outside during the day, getting healthy amounts of UV, don't overdo it. And then at night, they need to turn all the lights off. So low lights, lamps are okay, red lights are even better. But when the sun goes down, we're not eating. We don't have, the 70-inch TV blaring in our face. We're not on our cell phones, and the lights are dim. So that alone will do a lot of things for us. And it does a lot of things internally, not just externally.
Okay. So phones in the bed in the morning.
No, can't do it. No.
Why?
So it's the blue light exposure. So we can get into a little bit of the flicker effect as well, but it's really just the blue light, which is the backlight of the phone. So blue light is harmful because of what it stimulates in the brain. So it's very exciting for the brain. So at night in particular, if you have blue light exposure going into your eyes, when your brain is already trying to shut down, that blue light not only is destroying melatonin, which is supposed to put you to sleep, but it's also stimulating dopamine, which keeps you awake and motivated and excited. That's why when you're scrolling at night, you don't stop, right? Because that dopamine is just going crazy. And it's saying, yes, we love this, we love this, we love this. And you just, give me another kick, give me another kick. In the morning, it's a little bit different because we do want a little bit of blue light, but we don't want that much. So the sunrise does have a little bit of blue light in it, and it is supposed to be stimulating because we're starting to wake up and cortisol is going up and we need to be stimulated for the day. But the amount of blue light in that phone or on the computer or on the TV is much, much more than what's in the sun. Not only that, but it's not balanced with red and infrared.
Let's talk about kids and gaming and blue light and how that's impacting them. And I mean, I know that you do a little bit of work with school age kid athletes and stuff like that. So maybe you can then touch on like optimization as far as relating it to like their performance in school and their performance in sports.
So when it comes to kids and video games in particular, I think video games can be beneficial, but very limited amounts. So if they're playing video games, let's say sometime in the middle of the day for an hour, maybe up to 2, depending on the game, it can be beneficial. It can be stimulating for the brain, stimulating for the eyes. But when we get into nighttime gaming, which is what happens the majority of the time, that's when you have that degradation effect. So we already talked about melatonin. We already talked about the dopamine spike, but also blue light. One thing I didn't bring up was how blue light affects the mitochondria is it decouples oxygen, so it takes oxygen out, and it slows down the ATP function. So ATP synthase, right? Producing all the energy for our body, right? We need as much, yes. So ATP is like the gasoline for our car. That's what ATP is. And our body produces it in our mitochondria. Well, the accelerator has a lot to do with the light, or light exposure. Red and infrared light, it turns the engine really fast. Blue light actually slows it down. And so if we don't have enough energy coming out, our body can't do the things that it needs to. It can't, our immune system doesn't function correctly. Let's see, what else? Well, there's a lot of things that happen when mitochondria don't function. When it comes to blood regulation, sugar regulation, sleep is a huge thing. We can fix most people's sleep just within a week, just with light exposure. But the mitochondria is kind of the core of health, so to say. If you fix the mitochondria, a lot of other chronic diseases go away. Okay. And so we'll focus on that when people leave the clinic, and then we'll just make sure that they're exercising, they're not overdoing it, and they're stretching and stuff like that.
How does gaming impact athletic performance, academic performance, and like overall optimization of health? Do you feel like you touched on that enough with the mitochondria discussion?
So it's all about dose, right? So if the dose is too high, it has a worsening effect on all of those things, athletic performance and academic performance, specifically academic. Academic's a big one. When the dose is right, so I think the correct dose is right around an hour, give or take, depending on time of day and situation with the overall health. It can be beneficial because it does work the cranial nerves. So eye movements, going back and forth, being able to be reflexive, being able to make decisions very quickly. So those parts of the brains are stimulated, which is great. But if the blue light exposure is too much, it can kind of take away those effects and start to hurt other things. So there is everything is dose based. So an hour is fine.
Everything in moderation then.
Everything in moderation. There you go.
When it comes to chiropractors, there's kind of just, I feel like one association with them, which is pain, right? There's a massive network of chiropractors in Southwest Florida. Where would you say you fall?
I would say I'm more of a performance and wellness specialist, if you want to, put it in very blunt terms. Because I get everybody who have neurological disorders and we can help them from there. But then I have, the 80-year-old athletes or the high school athletes who want to perform the best they can. So it's really about extending health span and making sure that we spend the time with the person to figure out how exactly we can extend that health span in their daily life, rather than just having them come in, be like, okay, how's your elbow? Let's fix it. We'll see you next week. So it's more wellness.
So what are you seeing with your high school aged athlete patients versus like your 80-year-old athlete patients? Do you feel like there's a big discrepancy in like lifestyle and symptoms that you see or approaches? Or
No, high schoolers are much different than my older population. The older population, because they just go out there and they play, they do get injured quite a bit more. They have more aches and pains, and that's pretty typical as we get older. That's happens. It tends to happen a little bit more often. Whereas the younger kids, they'll get aches and pains, but they warm up okay. They cool down. They're eating a ton and they're still growing. So most of them they can kind of get over on their own. But then when they do come in, most of the time it's either for acute injuries, so things that are a little bit bigger, or performance. So if they want to get better or they want to kind of tune up before a big event or before a game.
as far as your older patients go, what would you recommend as far as lifestyle in order to like sort of and things to do before and after pickleball matches to like kind of optimize them and prepare them for that?
Sure. Well, for anybody, movement. Movement is 100% what we need to do throughout our entire life. You can't just go through life being sedentary. You're going to take years off your life if you do that. When it comes to before and after activity, be sure that you're warming up before activity. You know, even just a light jog for 5 minutes is going to be better than you just walking on the courts and, you know, get playing right away. Otherwise, when it comes to lifestyle, hydration, got to drink your water, get some electrolytes, and eat your protein. have a steak. I see too many people who, you know, they'll say that they're eating their protein, but that's like 40 grams a day. You know, everybody needs to be at least at about 100 grams, right around their body weight is optimal. But we need to eat more protein as a whole.
So as far as like diversifying muscle groups, strengthening joint areas, what exercises would you recommend that people do to prepare themselves?
So it really depends on what people can tolerate. So we'll just say for like the normal average Joe. So strength training, resistance training is going to be number one. And it doesn't matter if we're lifting 5 pounds at first because we haven't done it in a long time, or if we're getting all the way up into the 100, 200s. It has to be mildly difficult, but we want to build our way up appropriately and responsibly so we don't get injured. That's a very important aspect, not only for resilience in sport, but also resilience for life. So having more muscle mass, it protects against cancer, it protects against diabetes, and also cardiovascular disease. So there's a lot of things that it helps with outside of just playing your sport better. For some people, swimming is awesome. Swimming is a really great way for them to de-stress, but also still get cardio, because a lot of people don't like running, myself included. So swimming can be really great. It doesn't give you that same resistance. It is very different, but it is great exercise as well.
So full body.
It's very full body. Yes. And if you're not used to it, take it easy at first.
For sure. But great cardio for sure.
Great cardio.
Okay. To support those movements, what are they looking at nutritionally? You know, obviously diets are not as good as they used to be. What are the things that they need to be doing foundationally to support the movement and support the muscle growth, support the joint health?
Sure. So I like to keep it pretty basic for people, unless they really want to dive into the nutrition side. The basic protocol is have as much whole food as possible. Try to stay away from the boxes, from the bags, from the drive-through entrances. Try to get your food as whole as possible. Have as much protein as you can get. So right around that, body weight, grams per body weight. And when it comes to the carbs and the fats, we can manipulate that quite a bit. But if you're eating whole foods, fruits and vegetables, you can eat a lot. And you're probably not going to get to the numbers that are going to, wreck you. So whole food diet, if you can do that and you can stick to it the best you can, most of the time I don't have a problem outside of that. Otherwise, hydrate. Electrolytes are great. Sometimes we do have to pull in multivitamins just because the soil quality and food quality isn't as good as it used to be. And then everything in moderation outside of that. So I'm not going to say don't live your life. Whole foods only, fruits and vegetables, that's it. So when it comes to sweets and when it comes to alcohol, obviously no amount of alcohol is good for you, but moderation is key.
What have you seen with your patients that are heavy drinkers or that eat excessively as far as like symptoms go that they experience?
Well, I can tell you this for sure. They don't heal nearly as quickly as people who are healthy. So they do get injured a lot more often, but also that path to recovery, and it doesn't matter what they're doing, if it's, applied kinesiology, neurology, like what I do, or if it's general chiropractic or PT, most of the time it takes much, much longer for them to get out of pain and for them to actually heal compared to someone who's at least somewhat taking care of their health.
Would you say that's a result of the inflammation levels, or like the body just has to metabolize the alcohol and focus on that? Like what makes them not heal as fast?
So a little bit of both. Remember when we talked about the mitochondria function? So ATPase and ATP production is very critical in that. And alcohol is one of the things that lowers that amount. And it does it very well. It lowers the amount of ATP produced very, very well. So again, if you don't have enough ATP, you can't recover. So that's a major keystone that I hit pretty hard with a lot of people. So alcohol is a big thing, and that's really why it's the mitochondria getting all the way down to the cellular level. But yes, you are correct. The body has to be able to handle the metabolism of the alcohol as well, depending on the acuteness of it. And then metabolism as a whole gets altered because of the amount of alcohol they're drinking.
But give me an example of someone walks into your office, they're a regular patient, they're not a regular patient, whichever way you want to go. But what are they struggling with that results in sort of like the parasite issues? What symptoms are they presenting when they come to you? And how do those resolve? I mean, you already said they kind of like, they move better, but tell me about their journey with the symptoms.
Yeah, we have a patient who comes in with mild low back pain. They might have some skin issues here and there, and maybe some generalized pain in other places. Most chiropractors, they would say, okay, low back pain, let's rack and crack you. You're okay. Go see your dermatologist. What I would do is we would have that discussion, kind of figure out, what they're eating, what their lifestyle is like. We'd, have that full discussion, and then we'd test the nervous system. Well, most likely, if this is a case of parasites that we're looking at, we're going to see L1, L2, and L3, all those myotomes, fail. So they're going to be much weaker than what they should be. They're going to be a lot less resilient. We're going to utilize the red and infrared light. We're going to utilize our quantum neurology technique to help get those inhibition patterns to go away. And if they don't, that tells me, okay, we have something visceral going on, or something else in the nervous system is happening. I go through, I figure out where that neurological inhibition is taking place or what's causing it. And most of the time, if it is the L1, L2, L3, all in combination, it's going to be because of a parasite. So we test it, we make sure, and then we can say, oh, well, maybe that low back pain is because of the shared intervention of the gut, of the colon. Maybe that parasite could be affecting your skin, because it does. And maybe your generalized pain is also affected by that. So we'll go down that route. We'll make sure that that's something that we need to do. We'll test the supplements, make sure that the body is okay with it, it's appropriate to treat, and that it corrects L1, L2, L3.
What is L1, L2, L3?
Those are spinal levels. Those are nerve levels. Okay. So when we're looking at the low back, we have our lumbar nerves. So low back starts at L1 right at the top. It goes down to L2, L3, L4, L5, and then our sacrum is S1 right at the top there. So all of those segments have nerves coming out, and they go down and innervate our legs. Yep. So they innervate a lot more than just the muscle of our legs, but also the sensory organs. So all the feeling of touch down our arms and our legs, that's what nerves do. But they also have shared partial innervation with organs. Okay. So sometimes we have those indirect connections, and those organs, depending on their function, can affect the muscles in the sensory. Okay. So we start at the sensory, we see what's going on, and if there's something affected and it's happening at a deeper level, then we look at the organs.
Okay. When you say we start with testing the neurology, I've heard you say that a lot. What do you do?
So it's muscle testing. So it's a lot different than regular applied kinesiology testing, which has to do with a single muscle most of the time, and then you touch a bunch of reflex points and you kind of figure out what's going on there. I still do that in certain cases, but I test the myotome specifically. So let's say we go with L1, that's the psoas, L2 is the quad, L3 is the sartorius, L4 is a hamstring, and we'll go down lower as well. So I test all those muscles individually and I see, okay, do we have strength and resilience, or is there some inhibition going on where that muscle isn't able to react to sensory information appropriately? And if we have that response, then we fix it.
What does that adjustment look like? Like what do you experience if they're having issues in those areas exactly?
So the treatment, it can be really easy and very simple, and it can also be very complex. It's really individualized. So the simple method is just by using the red and infrared light, and this works probably 75% of the time. We use that red and infrared light. We put it on very specific neurolymphatic points or neurofascial points, and then all of a sudden we go back and test that myotome, that muscle, and then boom, it's locked in. We don't have that inhibition anymore. There's no more weakness. And most of the time, people, when we're testing those, at first, they'll have pain with it because that's what they come in with, right? They have pain. When we test it the second time, when that muscle's strong and the nerve is resilient, they don't have pain. And it took 5 seconds. Other times, it's not that easy.
So does it, I'm so, I guess, mind blown at the fact that like you can just use light and it just heals them. Is that something that's like, it lasts a long time?
It's all based off stress. So what it does, it doesn't heal them. So that is something that I do have to explain to a lot of people. The light exposure to that one specific point doesn't fix their hip problem, but it takes a safety mechanism off of the brain. So what happens with the brain, whenever you have an injury, all the fire alarms goes off, right? Everything lights up and it starts shutting things down to protect the muscles and to protect, the area. What happens though, as the days progress, the injury is gone, the threat is gone, but the alarms are still going off. So the fire's not there anymore, but the alarms are still going off. So what my job is to come in and turn the alarms off so the fire crew can come in and extinguish all the fires. So as soon as we turn the alarms off, we don't have that massive signal of pain, and it might still be there to an extent, which just means, okay, we need to do some manual work, we got to do some rehab. It's a process. It's a step-by-step process. But there are times where once we take the alarms out, sometimes we're good to go and the body can just kind of take care of it itself.
If someone is brand new to what you do and the way that you approach healing people, what would you tell them is like their best course of action to moving their health span in the right direction?
Well, number one, finding exercise that you enjoy, right? Making sure your sleep and wake cycle is appropriate, and eating a whole food diet. We really want to stick to the basics with most people. For people who have that taken care of, we can take it a couple steps farther. But I would say right now, 80% of people aren't doing the basics. And that's kind of why we have a health problem in the United States, because we don't do the basics. So I always start with the basics, and then we can expand from there, which really gets into the circadian side, making sure we're outside enough, making sure we're going to sleep at the right time, not eating at certain hours. If somebody wants to do, let's say, intermittent fasting, how can we balance that, and what times of the day should we be eating versus not be eating? How we can limit and recover from certain activities like drinking, for example. And so we can get into the details depending on, kind of lifestyle of the patient.
Mm-hmm. What are the biggest excuses that you hear from people when you are making recommendations for their wellness or to help them kind of optimize? What are you hearing?
I don't like meat.
Interesting. Like everyone loves meat these days.
Surprised. There's a lot of people who don't. Otherwise, people just don't want to. They don't want to give up their current lifestyle. They don't want to stop eating ice cream. They don't want to stop drinking alcohol. They have become so addicted to some of these artificial foods and beverages and activities, and that they just can't pull themselves out. Now, does it happen all the time? No. It's a little bit more rare, which is good. People are a little bit more willing nowadays to make that transition. But it's either they don't want to give up their bad habits, or they go in all at once and they get overwhelmed. So that's another thing.
Yeah. So if someone's chunking out, things from their diet and really let's stay on diet. What are your like top few things that you're like, get rid of this first, just to step them into it like a little bit so they're not fire hosing like everything around them and all of the ingredient labels and all of these things.
Sure. So to start, if let's say they drink alcohol moderately, okay, so alcohol is going to be the first thing. Anything in a bag or a box is going to be the second thing, and we'll just stop there. We'll say, okay, let's see how you do, and we'll kind of take little baby steps here and there, and we'll say, okay, let's start implementing some more vegetables. Get 2 more vegetables this week, or let's start doing some fruit, or how can we get your protein up this week? We really try to take baby steps because, again, diet is a large landscape, and there's a lot going on in the nutritional world. So we got to take it slow for most people, and we got to kind of, just feed them bite by bite.
Yeah. It's got to be overwhelming to be like, eliminate every bag and box from because the standard American diet is so convenient and box based and bag based that I'm sure like veggie straws are totally vegetables, right?
Yes, you'd be surprised. I have heard that one.
What, from like a micronutrient perspective and performance perspective for any athlete, would you suggest that they be eating?
From a supplemental aspect, kind of what you're going for. Yeah. So really for everybody, I think creatine is going to be great, unless you have certain kidney issues. But for the most part, 90% of people, 5 to 10 grams of protein every day is going to be fabulous, not just for the muscles and recovery, but also for the brain and preventing neurodegeneration. Trace minerals are going to be good at very low doses daily. That goes outside of sodium, potassium, because those are more macro minerals. But for a lot of people, you got to start with macro minerals, and then you can work your way down. Those are kind of the 2 biggest ones outside of just the regular multivitamin. And then it becomes case specific after that. I do look at omega-3s a little bit, but I want to make sure that they can have, 1 fatty fish meal every week. And if they're doing that, then we don't even need to discuss omega-3s. Because it's really hard to find a good omega-3 supplement because they get rancid so quickly, and there's so many bad brands that they're just taking supplements and pissing them right out.
Oh, that's never fun to waste your money on that kind of stuff. Let's talk about peptides for sports performance and how to like prepare your body around them and all that kind of stuff. What is your opinion overall on the peptide trend?
So very hit and miss, because what the peptides do, they affect the circadian biology. So a lot of the results that we get from peptides, you can get from appropriate circadian methods. So early morning sunrise, getting sun exposure, make sure you're getting UV, and then shutting the lights off at night. They express very similar molecules. So for the most part, I tell them, unless we need it for an injury, let's try not to go peptides. But in certain cases, peptides are needed, but I try not to use them.
Okay, interesting. What cases would you recommend peptides in?
So I've seen success with ACL recoveries, sometimes meniscus recoveries, partial muscle tears, kind of acute injuries like that. But if we're just looking at, I pull the muscle, or, my knees kind of hurt, not so much.
Or like overall health optimization, you'd say be paying attention to these foundational things: circadian rhythm, nutrition, movement, those kinds of things.
I always want to start with the basics. I don't want to jump in to start giving people pills and sending them somewhere to get shots, because the basics can be so impactful, but they also last a lifetime if you can build those habits. Because it's not just, okay, you have a torn ACL, we want to do these circadian things to help with that ACL. It's, okay, if you can get this habit of circadian biology, then you're going to take that with you forever. You're going to do it on a daily basis because it feels good to. Our body's actually addicted to going outside. And if you can make yourself addicted to that, then you're going to have a much healthier life than somebody who's stuck inside.
I feel like you already just answered my last question, but this is the last question. It is, there's a spectrum of wellness. I'm sure that you're familiar. And you know, people like you are over here and there's someone that's getting started. What do you wish like you could just tell them to get them on that route?
One step at a time. Make one change every week or every month, but don't try to jump in head first and do everything at once. You'll overwhelm yourself and you'll end up getting nowhere. You'll burn yourself out before you even start. And then when it comes to a practitioner, find somebody who listens to you. There's a lot of doctors out here and chiropractors, MDs, PTs, everybody's included, that you see them, they say, okay, how you doing? How's your knee? Okay, let's fix it. Let's get you out. They don't have a conversation. And the conversation, I believe, not only helps us with the diagnosis and helps us with curating your plan of recovery, but it also helps the healing process itself, because healing is personal, right? You don't want somebody to be impersonal with your life. You want somebody to be personal and be invested in your life. So make sure somebody is spending time with you, they're listening to you, and they have the same goals that you do for your health. Because if you don't, then you're just in the wrong place and you're wasting your time.